Welcome to the series of tapes on the preparation for the Restorative Technique exam. I'm Dr. Michael Duggan, and I'll be your host and your lecturer and your demonstrator and your critiquer for a series of 12 tapes covering every aspect of the exam from the beginning to the end. And in a minute we'll go over the particular titles of each tape. I'll tell you some general information about how we're going to proceed through this. However, there are a number of procedures that need to be executed on this exam. It's a difficult exam. It's probably the most difficult of all of the examinations that you need to take in order to become licensed in California. Starting from the national board exams, those are quite a challenge, but when you get to the restorative technique exam, or as commonly referred to, the bench exam, this is a new level of challenge. Compared to this, the clinical exam, or part 4, the licensure exam itself, can be much easier to get through depending upon the patients that you have selected. But the restorative technique exam does not depend on patients. It does depend on your skills, on your planning, on your attention to detail, and the detail can be such things as setting your typodont up correctly, making sure that all the teeth are in the appropriate interproximal contact so that you can do the preparations in the most ideal form possible. We'll talk about all these things as we go along, but we need to make sure that we are alert to everything that can go wrong during the exam, and that you've got everything under control as much as possible. The total length of this series is over 20 hours, probably approaching 24, 25 hours in length total. That seems like it ought to be plenty of material to get you through this exam. It's maybe less than it could be, but we have tried to assemble a set of information for you that will be as complete as possible, at least at this point. This is edition 1. There will be subsequent editions that have a little bit more in the way of sophisticated video work or computers, drawn illustrations and these kinds of things. But for right now, we are concerned mostly about getting the basic information to you, and that's really the goal of these tapes particularly. There are a number of preparations that we have to do, and as we have a tape for each preparation, we will start with a lecture format, pretty much the way you see me standing right now. I'll be lecturing in front of a flip chart with drawings and illustrations appropriate for that particular preparation design, and we try to cover as many of the basic principles as possible of what's going on. I'm not going to try to teach you how to do just a single prep, to do its prep in the quote-unquote ideal textbook fashion. Even on a typodont, there are not necessarily textbook preparations. There are textbook principles, textbook guidelines. There's a certain philosophy behind everything that we do in making a preparation, and this is what I'm going to teach you. This is what we're going to work on, so that when you get into trouble, when you get into a difficult decision-making process, then you can make the correct decision. It's even more important on the clinical exam that we work in this fashion. And so I'll start you now looking at these decisions and the fundamental basis for these decisions as much as possible. You won't be licensed in California as a dentist until you have demonstrated good judgment. That's what it takes to become an independent dentist. You must be able to judge different situations for yourself. So I'm not going to teach you how to make each individual decision. I can't do that, and nobody can. And what you should be able to strive for during this course, even on a typodont, which should be, you would think, fairly routine, it isn't. You'll need to make decisions, and you should strive for the ability to make those decisions based on sound judgment of dental principles, and that's what we'll be working on. So each lecture will emphasize as much as possible the basic principles that we use to decide how to execute certain preparations, how to adjust the outline forms, where the retention should go, where the flare should be, where the margins should be placed. And we'll lecture on the material first, then we'll do a demonstration. I will do each of the preps in turn as the particular tape requires. After the demonstration is over, there will be a series of critiques where I look at student work under high magnification on the video camera, look at student work in great detail, and critique that work by pointing out the various things about it that I either don't like or do like. The emphasis, of course, is on what the problems are. There are a lot of preparations that you'll see that are pretty good, but that have one or two problems. Remember that all it takes is one major problem to fail the preparation or the restoration. Remember that in the mouth, in a patient, everything can be perfect. Your restoration can be absolutely perfect. But if there's one problem with it, there's one thing wrong with it that is a major problem, that critical error is what will cost the lifetime of the restoration. The restoration will fall out or be damaged or degrade earlier than it should. That critical error, that single critical error, all else being perfect, will cost the life of the restoration, and that will cause the restoration to fail prior to its due date, if you will. And that's, of course, how we grade the preparations, or how the examiners grade the preparations during the exam. One error that is a critical error or a major error that is a failing error is all that it takes to fail that part of the exam. However else, everything you did was perfect. So I'll be looking specifically for little errors or big errors, whatever I can find that's wrong with the preparation. I'll comment appropriately on what is good, but mostly we're looking for things that are wrong. You need to be able to look at your own work and decide what the wrong areas are, what areas are incorrect, what needs to be changed. That's what you need to be looking for. You should not be looking at your own work with an eye towards what is right about it. You need to be looking for what is wrong and how to correct it. That's another part of the decision-making process. If you end up with a preparation that has an error in it, if you think that's a major error, that is one that would fail, you need to decide how to correct that error and perhaps convert it into a moderate error that is one that passes, that won't jeopardize the lifetime of the restoration. So these are judgments that you make as you go along, and we'll talk about those and illustrate those by evaluating student work on the end of each tape in this series. So the first area again is the lecture part of the tape, and then the demonstration part of the tape, and then the critique part of the tape. And so I'll go through now a list of tapes. There are 12 tapes in total, and we'll look at each one and just talk briefly about it. The first tape is basically the introduction, talking about the exam itself. You're watching this tape right now. The exam, how it's graded, and how to think in terms of what needs to be done during the exam. Included on this tape will be some critiques of some student work. One typodont, for example, with 6 or 8 preparations on it, all done by one student. You can get an idea as to student work that is not quite where we want it at the beginning, and some of the errors that are involved, sometimes large errors that are involved, and just get a general flavor at the end of this tape for the kinds of things that people tend to do before studying carefully how the details of these preparations and restorations should be done. Tape number 2 will be concentrating on the Class 2 amalgam preparation. The preparation itself, and we'll look at every detail about the theory, about how it should be designed, and then we will wait until tape 3 before we look at the condensation carving part of this restoration. These are the major areas where people tend to fail during the exam, so we spend a little bit more time talking about the Class 2 amalgam preparation. The tape number 4 is typodont equilibration. And on this tape, we need to make sure that we know how to get the typodont set up correctly so that it isn't the problem when we do the procedures and the preparations. If the typodont is not set up correctly, occlusal reduction, occlusal clearances are impossible to determine accurately, and we can't do our prep adequately. Tape number 5 is the full crown preparation. That spills over onto tape number 6, and a PFM preparation, porcelain fused to metal preparation, is also included on tape 6. Tape 7 is the 3/4 crown preparation. Tape 8, the 7/8 crown preparation. Tape number 9, the MOD onlay preparation. Tape 11 is where we start looking at laboratory work, impressions, materials, taking impressions, pouring up dyes, trimming dyes, articulation, and these kinds of things that are necessary in the laboratory part of the exam. The wax pattern fabrication is handled in tape number 11. And we'll be looking in detail at how to carve anatomy, appropriate contacts, occlusal contacts in wax patterns. And tape number 12, we'll look at exam strategy, how you should be planning your 8 hours during the day of the exam, how you should organize your time, what you should do if there's a problem somewhere along the line. And then we'll look at the results of student board, mock board exams. We're looking in general at how a group of students handles the exam as they go through, how their timing is, and how their decisions that they make at various points. That'll be sort of a documentary kind of section to that tape. Tape number 12 will be available probably in the area of March of 1995. All the rest of these are going to be available in the mid-February of 1995, and will be prepared very soon. Okay, the other thing that I want to say about these tapes, we have made these tapes in as complete detail as possible in order to best help you prepare for the exam. Some of the demonstrations, some of the demonstrated crown preparations, 3/4 crown, full crown, 7/8 crown, MOD only, they demonstrate the general principles that are needed, the procedure in which you should follow in order to make the preparations exactly the way you want. Placement of margins as much as possible, but every once in a while on these preparations there's a little defect, something I'm not perfectly happy with. These are things that I think I've pointed out pretty much during the tape, but be alert to these. There's not necessarily perfection to be achieved in these demonstrations, as much as I hate to admit it. I can't necessarily do things perfectly every time underneath a camera lens. Part of the problem is the direction of view. I try to show you how you should be looking at the preparation while the work is done as much as possible. Unfortunately, I can't always see exactly down those same lines while the preparation is being done. So there are little things here and there that you might find to judge, and I would find to judge imperfect about these preparations. On the other hand, the basic principles are there, and you should pay very careful attention to that. As we look at the preparations, I'll point out the things that I like or dislike, but for the most part, these are the ways that you should be proceeding to do the preparations. Pay very careful attention to how you should look at the prep, how you should look at the tooth, your angle of view that I illustrate, particularly when cutting through interproximal, making margins interproximally, how to avoid contacting the next tooth. And these are things that are very, very important and can be seen very well on the videotape. So, as we proceed then, I welcome you to the tape course. I hope you'll enjoy these tapes as much as possible, and that they benefit you very much. The lecture material has been found to be advantageous to many people to date, and I welcome hearing back from you, your input, your results, your critiques on these tapes, and anything that you might find to be changed or modified to be more helpful to you. I'd like to hear very much. Thank you, and I'll see you again at the end of this series. Okay, welcome. We're starting a new course on preparing for the California licensure exam bench test, part 3 of the California exams, or the kind of exams you have to go through in order to get licensed in California. So this will be part 3. This is the hard one. Okay, this is the exam that requires the most skill and attention to detail. That's what's most important in this particular exam. Many skills to learn. There are literally hundreds of things that you need to pay attention to as you're working through the exam. Some of you have taken the exam before, some of you have not. And so those of you who have can offer a lot to the people that have not. But what I do is I make it my business to take what is known by the people that have taken the exam before, take those experiences, and then relate them to everybody as much as possible, doing it for the first time. We're all going to start from the beginning. Basically, whenever I've worked with a group of students, everybody benefits when we all start right at the beginning and work through, take one type of procedure at a time, and just be very organized as we go through and work out all those little details that we need to, so that by the end, when we do our mock board exams, you're confident, go right through whatever I throw your way in terms of the preparations that I'm asking you to do. You're ready to do them and feeling good about it. And you know what to look for in your own work to tell yourself, this is good, this is bad, this needs to be fixed. There won't be questions in your mind when you get to the end. Is this good or is this bad? Okay, you'll know. And so then we need to be able to learn to evaluate how good our work is, and that's most people's weak point. At this point, they can do a prep and then look at it and think it's good. 3 months from now, you'll do the same prep and you'll look at it and you'll think, this isn't good. Well, you won't be doing the same prep 3 months from now, but it's important that you learn to evaluate what is it you've done, and then work on being able to repair what needs to be fixed. That's one of the big things about this exam. There's a lot of judgment in this exam. You wouldn't think so. You would think this is a very straightforward exam. All the typodonts are the same, right? The typodonts are not the same. Some students take typodonts into the exam that they can't possibly pass with. Okay, they will fail because of their typodont. So all teeth are the same, right? The teeth on this typodont are polished by hand. That means they're all a little bit different from each other. So they all fit together a little bit differently. Okay? And then the particular tooth that you are having to prep for the exam, who knows which tooth you're going to get. You have to be familiar with the preps on each of the teeth and what the general principles are underlying a good design for preparation on those teeth. Once you have got all those principles in mind, then you work through and you do your prep. Now, it still sounds like it could be fairly routine, fairly automatic, but not everybody does a perfect prep the first time. It doesn't always go perfectly for everybody every time. You get through the part of the prep and you decide, uh-oh, I just noticed something that I did wrong. Okay, then you have to decide, well, what am I going to do? Okay? And what you're going to do is try to fix it. And so if you decide that what you have done is a major error, then you have to try to convert that into a moderate error. Okay? Do you remember how the exam is graded? We'll talk about that in a little bit, and I'll show you some of the numbers and the kind of questions you're going to have from me is, okay, that's an error. Is that a major error or a moderate error? In other words, do I fail because of that error, or do I pass because of that error? By the time the course is over, I'll give you a pretty good idea as to what the major errors and the moderate errors are. And then you'll be able to look at your work and say, okay, I've got a major error here. Maybe I can fix that by overextending a little bit. So I get a moderate error for overextension, but at least I don't have a major error because of undermined enamel. These are the kinds of things that we're going to work through. So there's judgment comes into play in this exam. Not nearly to the degree that it does in the clinical exam, but then again, any of the crown preps that are done on the clinical exam would fail the bench exam. Okay? So when you're working in real patients, in real life conditions, things are not textbook. Okay? You just have to be able to do a prep that works, that will enable the crown to stay on or filling to stay in or what have you. And that's generally acceptable for the patient, then you pass. They're not asking you for the bench exam to do generally acceptable work. They're asking you to do extremely good work. Okay? They're asking you to do work that's as good as the top 10% of any graduating class in any dental school in California. And you can do it. Okay? I've seen a lot of people study for the bench, and believe me, when you guys finish this course, when you're ready to take the exam, you'll all be doing work that's better than almost all of the undergraduate students at Loma Linda University, for example, where I teach. I know just how they work, and they're very good in many ways. They have much more clinical experience than anybody else in any dental school in the country. But like most dental students, they have not refined their skills in textbook preparations to the extent that you will by the time you finish here. Okay? They have a lot of clinical experience, but they don't do well on ideal Class 2s. I mean, they do, but not as well as you guys are going to do. So when you take the clinical exam, your Class 2 on your clinical exam might be acceptable and therefore pass, with that same outline form, same shape or what have you on the bench exam isn't going to pass. Okay? You need something that's as close to perfect as possible on the bench exam. So that's what we're going to strive for. I will teach you to be critical of your own work. And I mean really critical. I'm not going to tell you that it's good if I don't think it is. Okay? I want to teach you to be very rigorous with your examination of your own work, and so that when you take the exam, generally you're going to be a little disappointed, okay, because that Class 2 was not perfect. Okay? You extended just a little bit more than you really wanted to, or you had your gingival depth was a little more than you really wanted it to be. Okay? You know, you're going to be disappointed with slight errors. Okay? You're going to ask perfection of yourself, and you're not going to get it. Okay? But you're going to pass the exam. Okay? Because you're going to be more critical than you really need to be. That's the important thing. I don't want people feeling overconfident if they're not doing good work. I want people doing good work and feeling that they know every time they make an error, they know it. Okay? And that you know when you take the exam, not everything is going to go 100% smoothly. It never does. You might finish the exam and go, "Wow, I was hoping it was going to be perfect, but there was, this went wrong, this went wrong, this one. But I fixed it all, so it should be fine." And you'll find that you do very well on the exam. And again, fixing things and adapting to unexpected developments, that's a very important part of this exam also. You've got 8 hours to do a lot of work. And I'll show you how to organize your time and be as efficient as possible. You must make sure you have time left over for unexpected things to happen. There will be unexpected things that happen. For example, you have been working on your typodont, you've made your casts, you have a nice impression and so forth, and then you put it on the corner of your desk. It's all articulated, ready to wax up. Put it on the corner of your desk. Somebody comes along and knocks it on the floor and it shatters. Okay? That happens. You didn't expect that. All of a sudden you're behind. You have to retake an impression and all this kind of thing. So you have to be prepared for the worst. Each exam site is different. The type of equipment that's available is different. If you go to UOP and take the exam, well, obviously it wasn't UOP last time, it was UCLA, I think. They only had like 2 working model trimmers for everybody to use. And so there was a half-hour line waiting to use a model trimmer. Well, how are you gonna deal with that? Do you have enough time to stand in line for half an hour during the exam and not go crazy in anticipation and worry? Okay. Well, one way to deal with that is don't use a model trimmer. Figure out how to take the exam without using a model trimmer. And that's one of the things that we're going to do. When you take my mock boards, you won't be using the model trimmer. Okay? You'll do everything by hand, and you'll save, and it'll go fast, believe me. We have ways of taking impressions and pouring up casts that will allow you to get your cast made and your everything articulated and on your hinge very, very quickly. And that's the most important thing. And you won't need to do a model trimmer to do it. You can do the whole thing in minutes, and you won't need to use that model trimmer. So you save yourself half an hour waiting in line. So we'll try to find ways to do things very quickly, very easily. And so if you do need that extra half hour that you didn't expect you were going to need, that you've got it. You've got to get the preparation time down. Most of you, if you have to do an MOD onlay, will spend a couple hours, maybe 2.5 hours, maybe 3 hours right now. Some of you have been doing it with carbide burrs and really taking a long time. Some of you can probably do absolutely gorgeous preparations, 3/4 crown, MOD onlay, whatever. Every once in a while I have somebody that can just really do a beautiful job. Smooth surfaces, everything is just very elegant looking. Then maybe there's some things that need to be changed about the design, but do beautiful prep. But it takes 3 hours. So if it takes 3 hours to do a beautiful MOD onlay prep, don't do a beautiful MOD onlay prep. Do whatever you can do in an hour and 15 minutes. Okay? So you have to change your approach to things so that you can actually complete an acceptable onlay prep in an hour and 15 minutes. Again, you have to balance between making it beautiful and making it work, making it meet all the requirements for a functionally good restoration in the amount of time that you need to spend on it, okay, and no more than that amount of time. All right, so what I'll do is I'll tell you a little bit about how we're going to organize the course. Most of you have already seen the outline that we have for the general course as we go through, and then we'll talk a little bit about equipment and some of the other things. I also want to talk about just a minute about how the exam is graded. When we do the mock boards, we will be using the standard grading sheets that they use by the Board of Dental Examiners. At least they're copies of the standard grading sheets, and so you'll see exactly what is looked for on each prep. And I will give you copies as we go along, so that you can see the criteria that they're looking for. But you'll learn all these things as we go through also, because I'll have you looking at each of those different areas and evaluating them for yourself pretty well also. Okay, the course is set up so that we start with today, introductory, talking about the exam. Then we get into the Class 2 preparation. We always start with that. We'll work very hard to make sure that you can do the ideal Class 2 under each circumstance that you have. Anything that comes along, any tooth that we assign, any situation with respect to your typodont, you need to be able to handle. Even those situations where you have two teeth that are pushing hard against each other, and you prep one out, and then it leans over. Okay, it's almost impossible to do a good Class 2 on there, but you'll learn how to do it. You won't take a typodont like that into the exam, but you learn how to deal with all those situations. Anyway, we'll do the Class 2 preparation, and then we'll get into doing the Class 2 condensation and carving. And I'll show you a technique for doing that that's easier, faster, safer, and gives better anatomy than maybe than what you've been using before. Then throughout the rest of the course, we'll be concentrating on other things, but we'll always be doing Class 2s also. So the scenario with respect to taking the exam is that in the morning, when you're taking the exam, after your typodont is approved for equilibration, you're going to prep the casting preparation that you're going to be eventually doing the wax up on. Then after that is prepped, you'll take the impression, you'll pour it up, and while that's setting, you'll do your Class 2 preparation. Once the Class 2 preparation is done, then you'll go ahead and submit that for grading. And you'll submit it earlier than everybody else, hopefully, so you'll get it back fairly quickly. But it doesn't really make too much difference whether you get it back fast or not. You've got lab work to do while that's going on. Because while you're doing your Class 2 prep, once the Class 2 prep is done and submitted, you've got your castings that are already set while the Class 2 prep is being executed. So then you're ready to do a lot of lab work once you submitted things for grading. Anyway, this combination of a crown prep and an amalgam prep will be working a lot like that. In a 3.5 hour session, we'll have you later on as we work on the different casting designs: full coverage, 3/4 crown, 7/8 crown, MOD onlay, PFMs. We'll work on each one of those in turn. And as we spend 2 or 2.5 hours out of our 3.5 hours working on a particular casting design, then for the last hour we'll do another Class 2 prep. Okay, so practice doing both of those things in sequence and relatively quickly. So when we get to the end of the course, you'll be used to doing a casting prep and then a Class 2 prep, like that. And then toward the end of the course, what we'll be doing in 3.5 hours is a casting prep, impression, pour it up, and then do a Class 2 prep, and then work through like that. So you will be approaching the sequence and the time schedule for the exam slowly as we go through the course. So things will feel very natural. There will be a natural sequence to things as we work through the course, and that's going to be helpful. So once we've done the amalgam part, then we'll start with full crown. The reason we'll go to full crown next is because the first thing that we do with full crown preparation is the occlusal reduction. And the occlusal, on the lower teeth, the occlusal reduction, which is an area where a lot of people fail, the occlusal reduction on the lower teeth is identical. Full crown, 3/4 crown, 7/8 crown, MOD only. It's all the same occlusal reduction. So once you learn how to do the correct occlusal reduction, occlusal anatomy on the lower teeth, then you can do the same thing for any of the other preparation designs. It's the same thing. For the upper teeth, the full crown is different from the partial coverage crowns only on the facial cusp. The occlusal reduction is a little bit different on the facial cusp because for the partial coverage designs, you're trying to conserve a little bit of the enamel that's visible, from a talking perspective. That's not much of a difference. Almost all of the occlusal reduction is the same on the upper's full crown versus the partial coverage. It's just that one little difference. It's an important difference, but so the almost all the teeth, the occlusal reduction for the full crown is very similar to what we're going to be doing for the partial coverage. So we'll start with that. Then the next thing that we'll do with the full crown is the facial reduction, and the facial reduction is for the full crown is exactly the same kind of thing we're going to be looking for again all the other partial coverages except for the 3/4 crown. Wherever we have anything that is covering any part of the facial surface, we need to be concerned about the contour and angle of the facial surface of the prep compared to the facial surfaces of the adjacent teeth. If your adjacent tooth is like this, then your prep should be axially reduced but parallel to the tooth that's adjacent to it. Okay, so we're going to be looking at the facial to make sure that we have the appropriate angulation and appropriate amount of axial reduction. And so that's critically important on PFMs. With a full crown, full coverage gold crown is a good way to learn how to do that. And then the next thing we do is lingual reduction. So we're going to be paying very much attention to the relationship between the planes, facial and lingual, how much they draw together, whether they're undercut. All these principles we learned from the full crown, they apply to all the other restorations. Okay? And then the interproximal cuts. That's, again, the same for the full crown as it is for all the other ones, except for on the other ones, sometimes you cut through the interproximal and you stop before you come out onto the surface. For 3/4 crown, you stop. For the 7/8 crown, you stop on one side and you go all the way through on the other. So there's so much similarity that we learn all the basic principles, or almost all the basic principles, on the full crown. Then we move on to the partial coverage, and each one just adds one new thing that we didn't have on the full crown. So partial coverages are going to seem a little bit more easy once we have the principles developed for the full crown. So to the full crown, I'm going to go to the 3/4, and then it's very easy transition to make it to the 7/8. Actually, right in there, we'll also have the PFM. Full crown and PFM are very much related to each other, but we'll have the PFM either maybe between the 3/4 and the 7/8. So we'll get it right in there. And then the last thing we'll do is the MOD onlay in terms of the preparations. And as we do, as we work on a new prep that we haven't done before, we'll probably spend the whole evening on that. And the next evening we'll spend doing that prep, and then also a Class 2 amalgam. Okay, again, catching back up on that. Once we finished all of those, we have all the partial coverages done, and all the preparation designs worked out. Then the next step is to get our lab work under control. And we'll be starting the lab work, as I said, while we're still learning some of the preps. We'll be getting fast enough so that on those second days you can actually do the prep and take an impression, pour it up, and then do your amalgam. Okay? Then we have a lot of casts to work with, and we can practice the lab work and get into that fairly easily. One Once we get into lab work, we'll have some casts articulated. We'll have any number of them that we articulate and hinge and trim the dies, work on those things, and then we'll be able to do the wax up. So last month will involve a lot of waxing up also. A lot of getting the lab work, very precise, making sure you don't forget anything as you go through the lab work, and then doing the waxing up as well. So we'll work pretty hard on getting some nice natural tooth anatomy when we do the wax ups. Okay, anyway, that's the general flow of the course, and it's worked very well many times, and for a big variety of students. Like I said, I've had students that have been extremely good, and when they came in, but really weren't quite ready to take the exam, and actually even 12 weeks seems like a lot of time, but even people that are very good that have come in here have benefited a lot from what's going on here. Everybody does. When I have people in my clinical course, which is the course for the Part 4 exam, I'll have people in there that have been in practice for 15 years. They've been doing general dentistry for 15 years. And you might think, well, why are they taking a course? To prepare for something they already know how to do. Well, what's really amazing is I find out that those are the people that take more work to get them ready for the exam than the people that have only been out of school for a couple of years, or had an education that maybe wasn't quite as good. Everybody starts from a different place, but we're asking for perfection. And people that have been out practicing for 15 years normally are very far away from whatever perfection they achieved when they were in school. They've lost all of their finesse. Their attention to detail is gone. So this is a good time to, if you've been in practice for 15 years, it's a good time to build this attention to detail back into your life again. So I'm real happy about teaching both the Part 3 bench course and the clinical course, because I see people that either had a relatively weak training to begin with, or have just been out losing all of their good skills, for 10 or 15 years. I see everybody getting back up to a really high level of training again, and seeing, maybe for the first time, what you really need to do in order to have a preparation designed correctly and that'll be functional and that'll really work well for the patient over the long term. We should be doing amalgams that last 50 years. Okay. And how many amalgams do you see being done out there that last 50 years? We should be doing crowns that last 25 or 30 years easy. And you don't see that very often either. You guys will get through these exams, and my good feeling is that when you get through these exams, you'll be much better dentists because you've trained for them very thoroughly. Okay. So for the next 12 weeks, for the next 12 sessions, you're going to be working very hard. Okay. And that's the nice thing. I work with a lot of undergraduate students that are learning their skills and getting their DDSs, and they're young for the most part, and they're tired of going to school, and they're not motivated as much. They want to learn dentistry, but they like to party also. Okay? They want to have some fun while they're doing all this other stuff. Okay, you guys have had all your fun. Okay? You've been having fun for years and years and years now. So you guys are so much more motivated and so much more driven to learn than the normal undergraduate student. It's actually far more pleasurable. I should maybe hide this tape so that my undergraduate students can't see this. It's much more pleasurable to teach you guys than it is to teach the undergraduates because of the high level of motivation and discipline. And that's what's required. That's what's required. It's really necessary. I'm expecting that when you prepare for this exam, that what you do here is not all you do to prepare. So sometimes it's only possible for people to work here and they can't work at home. They can't find any other place where they can do some work. But most of the time people are practicing at home as well. That's very helpful. So in general, what I'll do with you is each time we finish a day, I will tell you what I'd like to have you do before next time. And then next time you come, I will evaluate that work with you, and then you can start again something new during the session. The way I do that is the following. I don't just have everybody bring their homework and then sit down and look at yours and then look at yours and keep everybody else waiting. Okay? When you come back each session, the first thing that we do is discuss what we're going to do that evening, okay, or that day, whatever, that session. So we'll discuss what we need to work on, and I might get up and give a little presentation showing the kinds of things that I'm expecting and some of the details, and then we'll get everybody started. Once everybody's started working, then I will go around and look at what you've done for homework. And before the evening is over, I'll look at everybody's homework. Okay? But I want to make sure that everybody's working all the time. Okay? They're either working or talking to me. Okay? That's the important thing. And normally that works out very well. So don't expect me to immediately look at what you've done for homework when you first come. Sometimes I will, if I'm having you do as an exercise that evening a tooth that's either a tooth that you've prepped at home or adjacent to a tooth that you've prepped at home, I'll give you a quick evaluation of what you've done there, and then you can replace the tooth and start to work. Okay? But generally that won't be necessary. Later on, we'll just take a look at what you've done independently. Sometimes it's useful to have 2 typodonts. A lot of people have 3 or 4 typodonts. They might have one that's sort of like the typodont from heaven. You know, it's perfectly equilibrated, and they'll never touch it again until they get into the board exam with it. You know. So maybe they paid somebody $300 to equilibrate the typodont for them, and that's it. That's going to wait 4 months until the exam comes along. Usually there's a typodont we work on here, and it gets beat up, and we work at it pretty hard. And there may be another typodont that you use at home to bring back and forth for practice, so you can sort of work on both things. A whole variety of different ways of doing things. You can certainly get through with just one typodont. They're expensive, so it's useful to be able to get through with one typodont. Okay, speaking of expense and equipment and this kind of thing, you know about the course situation, but let's talk about equipment, because there's a lot of things there that we need to cover, and especially when it comes to things that I'm going to be making available to you at a pretty good price, because I've tried to buy things in quantity, and what we'll do then is, if I buy enough teeth, for example, I can get really good prices for them. So you'd normally pay $1.57 to probably $1.65 or more for an ivory tooth, and I can get them for $1.40. So what we do is we start out at this point and say, let's basically order a basic set of teeth is 120 teeth. So still turns out to be expensive, but it's a lot less expensive than it would be if you're buying them at UCLA, for example. But 120 teeth, I forget what it is. It's $1.40 a tooth plus tax, and you can add it all up. Anyway, you're going to go through a lot of teeth in the next few months. One of the times you're going to go through the most teeth is at the end when you're working on equilibrating your typodont. You're going to be plugging a lot of teeth in and out there to try to get just the right set that fits beautifully to get that perfect equilibration. Okay, I'll say it right now. The more perfect your typodont is equilibrated, the better your chances of passing the exam. If you have a typodont that is improperly equilibrated, even though they allow you to use it for the exam, you may find that it makes some of your preparations very difficult to do well. Okay, so we'll be certainly working a lot with typodonts and teeth. The other thing that we'll be using is a lot of burrs, of course, and if we could zoom in on this right here, I'll just show you what we have in the way of a set of burrs for this particular course. This was designed for either the Part 3 or the Part 4 California board exam. We can probably come in there again. And it has 28 burrs in it, and they're arranged in rows, and the top row is for PFMs, and then casting preparations, amalgam preparations, and there's a row of finishing burrs. And then the bottom row is some miscellaneous burrs, including burrs for doing your typodont equilibration. So this works out real well. I've ordered 50 more of these, and so they should be in hopefully maybe even before next week. And so we'll be able to have a lot of burrs to use. Now, having a set of burrs like this is great, but if you don't know how each one is used to the best advantage is not very helpful. So obviously, as we go through the course, I'll describe to you the preparations and how we can do those preparations using these specific burrs. So this is a big help. So typically, everybody buys the burr block, and even for the clinical course, you'll see there's some slow speed round burrs in here. And those are for removing caries. You're not going to need them this time, okay? But then again, for the clinical course, they're not going to need some of these burrs that are designed for PFM preps up here. Lingual preparation, smoothing and cutting on upper anterior canine, for example, PFM. You don't need that for the Part 4 exam, but you need it for the Part 3. So there's a few burrs that you won't need this time, but you'll need them next time, and the same thing with the other students. But anyway, in general, everybody buys this. And then usually about halfway through the course, we put in another order for replacement burrs. So you'll be going through the burrs pretty quickly. The burr block is not very expensive. It's pretty, again, they're all Brasseler burrs. It's about the finest you can get, and they're much less expensive than they are in the if you were to buy them individually. That's for sure. So anyway, we'll go through lots of burrs. We want to make sure that we're all using similar burrs. If you have burrs that you've used in the past that you really like and you feel comfortable with them, by all means, stay with them. But I will show you some other approaches to things that I think you'll probably like quite a bit. And we have plenty of time for you to decide which way you like to do things. Okay, the other thing is hand instruments. You need to be able to have enough hand instruments of the right shape and size to cover things for the exam. What I have done for my clinical students, and most of the bench students also, if they don't feel as though they have all the right hand instruments, go ahead and buy this. Obviously, you don't need a sterilization cassette for the bench exam. Nobody cares whether your instruments are sterile or not. But we certainly do for the clinical exam, and I'm sure you'll all be taking the clinical exam in the not too distant future. So having a set of instruments that can be sterilized very easily and works for certain procedures is a big help. So this particular set is designed for the amalgam, and this actually isn't the exact cassette. This is a prototype cassette. I didn't have any more of the actual ones, but I can just give you a general idea as to what's involved here. This amalgam setup. There's basically everything that you need to do the amalgam, not more than what you need. I mean, a lot of instruments in here, but this is no more than what you actually need. There are four. There's Mirror and Explorer. You don't need the Mirror for this course or for this exam. You certainly need the Explorer. And the Explorer is it's a number 2 Explorer, which is basically of a specific design that makes it easy to reach down into deep boxes and this kind of thing. You'll find this design of Explorer to be very useful in your future work clinically, but we start with it here. It's useful to help evaluate clearances of margins and Class 2 preps and things like that. Anyway, there are 4 cutting instruments that are gold tipped, and it's not gold, but gold colored because of a special alloy that's put on there in order to increase the lifetime of the edge sharpness. So there are a hatchet, a chisel, and 2 gingival margin trimmers. And then we get in, there are a couple of things like the paste applicator and the spatula combination tool right here. That won't be useful for you, but all the condensers and the carving instruments will be. You'll note one thing. On the cutting instruments, this is one thing we need to be careful about. The width of the blade, and this particular cutting instrument is 1.3 millimeters. Okay. Now, 1.3 is better than 1.5, and 1.3 is better than 1.0. Okay. So we're gonna be worrying about, well, what's the exact instrument that we ought to be using to instrument certain parts of different preparations. And for example, when you're doing a Class 2 and you're instrumenting down in the box, if you use a narrow instrument like a 1.0 millimeter instrument, here's what happens. Your box is deep enough axially so that the instrument has a lot of room where it can move around. And you might think, gee, that's great. I've got lots of room, I can see what I'm doing and stuff like that. But what happens is that there's enough room, it's one of these things where there's enough rope to hang yourself, okay? There's enough room so that When you put your instrument down, if it slips, then it can slide over, and the edge, in the corner, one corner of the blade can hit the edge of the gingival margin. Okay, and when you get enough pressure right at that margin, you get a chip. Okay, whereas with the 1.3 millimeter wide instrument, there's not so much room, and even if you slip, it can't hit too close to the gingival margin, and it's much less likely to give you a chip in that area. Once you've chipped that margin, then you have to extend gingivally, and you've got a big problem. Okay, a 1.5 millimeter wide instrument is too wide for most things, especially for a premolar box. That's just a little bit too big an instrument. It won't fit in a conservative box. So 1.3 is about right. Now, a few tenths of a millimeter here and there, that's a big difference. Okay? And of course, as we go through this exam, you'll discover that a tenth of a millimeter here and there in your prep, outline form, extensions, these kinds of things, makes a big difference. So we'll be looking for little tiny details. Okay, which brings up another point. How well do you see little tiny details? Can you tell me when there's a defect that's only a tenth of a millimeter in size? How do you see those things? Okay. For those of you who are like me, that have eyes that have been around for a little while, it's kind of hard to look into some little tiny hole and see much detail about what's going on inside. Okay? So if you don't have any way to supplement the capabilities you have with your eyes, then what you do is you get an explorer, and you use the explorer as an extension of your eyes. Okay? A sharp explorer can tell you all kinds of information. If you have an explorer whose tip is half of a tenth of a millimeter, then you can detect things that are a tenth of a millimeter pretty easily. Okay? If your explorer is dull, you can't tell what's going on. Okay? Just like your eyes. If your eyes are dull with age, then you can't tell what's going on. Now, a lot of people use some form of magnification. Okay, how many of you use magnification of one sort or another? Okay, not too many. Okay, let's give that some thought as we go through. If you really want to do it well, then you need something like these. Okay, what these are they're normally referred to as loops. I'm not sure optically if they're actually officially loops or not. But anyway, most people call these loops. So they're basically little telescopes, and they're designed to focus at various distances from your eyes, from your face. And when you see me from now on, this is the longest period that you'll ever see me where I won't be wearing these, by the way. Okay, so I'll put them on now so you'll see what I'm like normally. Okay, this is my normal self. Okay. When you see me without these on, you'll go, wait a minute, there's something wrong here. You know, he's changed his hair, or you know, whatever. Anyway, this is the way I normally appear, and this allows me to be able to look down at any of these preps and see every detail. Okay. Now, why should I be able to see more clearly what you've done than you do? Okay, that's not right. Okay. You should be able to see your work as well as the examiner, or you're just going to be guessing. Okay. Now, again, if you use the explorer well, if you know what you're feeling for, use the extension of your eyes to your explorer, that's great. But I recommend getting some kind of magnification eyewear. Okay. There are these bands that you put around your head, and you pull down the thing. There are a couple of like magnifying type lenses. Those can be helpful. They might magnify the tooth twofold, something like that. They allow you to focus more closely to your face more comfortably. That's okay. That's the most cost-effective way to go. You're looking at anywhere from $30 to $70 or $80 for one of these little things. It's just a single lens, plastic or glass lens, that comes down in front of your eyes, just like a magnifying glass. Sherlock Holmes. The next step up from there is something like this, where we have an actual telescope with many glass elements in it, and then you can adjust focal distances, magnification, field of view. If you have the finances, then I can get you a very good price on what are probably the best of this kind of thing. There's one company that makes some that you actually put on, you wear glasses, and if you have prescription lenses, you can get them actually inserted into your prescription lenses as well. Anyway, you wear glasses, and they're actually those little telescopic things are actually inside the glass. They come right up just outside your eyelashes, okay? And they're fit to you. They're fixed so that they match the space between your eyes. That's what's most important. And so those work out very well for people. Normally those cost $700 or $750. I can get them for you, or basically you can get them by calling this guy, and as long as you tell me you're one of my students, then he'll give them to you for the bargain price of $525. So that's if you want the best. If you want anything that is maybe not quite that expensive, then you're looking at $200 to $300. It may be that your eyes are such that the $200 ones will be serviceable for you. Okay, and maybe not. The $200 ones don't work for me. Our eyes are very close together, and they're not sharp, close enough to the inside edge for me. When I look through those, everything is kind of blurry. But there are some that are available for $300 or $350 that work pretty well for me. Okay, not as good as these. So these are options that you can try, but you should experiment around, look around, do some thinking about it. I'll be happy to talk to you individually about that. Okay, any questions at this point? Nothing. I've covered everything. All right, well, we'll call it quits then. We're all done for the day. Okay, no. Anyway, this is today. This is what we're going to be starting, is our bench course. This is me. Let me just flip this over. Oopsie. Just want to say one more thing about the exam itself before we get into looking at a few more details here. Once I lay this down, I think that'll be easiest. Okay, most of you are aware we're going to be doing a casting prep, which is called Prep 1, the first preparation, and that's also going to be used for making stone models and the wax up, re-wax the crown. We'll be doing an amalgam prep and condense. And then there's the second casting prep. Okay, those are the three parts to the exam. They are graded independently of each other, and as I'm sure all of you know, you're allowed to fail one of those parts as long as you don't fail it too badly. Okay, so that's the good news. All right. The first casting, there are three parts to that exam: the preparation, the models, and the wax up. And they're graded 40% for the preparation, 30% for the models, and 30% for the wax up. The amalgam, preparation and condensation, 60% for the preparation and 40% for the condensation. And the second casting prep, second preparation, is 1 grade. Okay. Now, note that when we have, basically, what's the most critical part of the exam?
Correct.
Second casting.
The second casting prep. People forget that. Okay? That's the most critical part. Because 1 grade, that's it. You do one thing, and that's your grade. And if you fail that, if you get a 60 on that casting prep, no matter how well you did on everything else, you're not going to make it. Okay? Now this is also one of the last things you do in the afternoon. You do the wax up after this. So this you do later on in the let's say early to middle afternoon, and you need to make sure that you have some stamina so you're not too tired. But you need to pay attention to this one. Okay, it's an important one. Anyway, you can fail the prep on the casting. You can fail the first prep and still pass that section. Okay, which is great. You can fail the amalgam prep as long as you don't fail by too much, and you can pass the amalgam because you have a nice condensation carving. Okay, so what are some of the things you have control over? Okay, the lab work, the model forming and things like that. You've got a lot of control over that. If you just have your lab work so it goes like this, then that's a given. You've got that. You got a good grade on those things, and that doesn't, if your hand slips a little bit at some time or another while you're doing your lab work, it's a big deal. Okay, that's no big problem. As long as it's not when you're trimming the margins on your dies or something. The wax up also. You just work on your skills and you can do a nice wax up. Okay, again, a slip with your hand is no problem. You can fix it. Okay, if the thing breaks or somebody steps on it or whatever, well, you just do another one. But it's these preparations that if you make a mistake, you can't fix it. You can reduce the severity of the mistake, but you can't start over again as you can with some of these other things here. If your dies or your casts break, you can pour them up again. That's fine. We'll make sure that we're ready to pour them up again. Make sure that you're always ready for them to break. Okay. Anyway, the three preparations are the most important parts, so we'll be spending lots of time on that. But it's also very important that these things right down here that you have control over, that you're very good at. You're confident in this lab work, and that's really impressive. Then you can fail this prep and maybe even pass the whole. The lab work and the wax up, that's 60%. Okay. If you can get by with only slight errors on that, you've got an 85 for 60%. You can get a 65 on the prep and still pass that part. Okay, so that's real nice. So again, we're going to concentrate on making sure that we know the strategy of the exam and basing it on the reality of the exam. Okay, the amalgam preparation is still important, but the carving you've got control over. Okay, if you can do a good carving, a good condensation, you can do it every time. And if you blow it, cut it out and do it again. Okay. Again, you can make a mistake on the condensation, and then you can repeat that if you need to during the exam. You don't have to go with the first time. If your contact's not there, cut it out and do it again. But you should be practiced enough with your condensations and carvings, so you're doing a beautiful job every time. The anatomy is great. All the margins are just exactly the way they should be. Nice tight contact. So you've got a lot of this under control. You've got 60% of this one under your control. And that you can basically redo what you need to. I'm sorry, 40% of this one, and 60% of this one up here. Okay, so it's a good way to think about it. Puts lots of pressure on the preps, that's what we expect. But that's not all the exam, except in this part right down here. So we'll be very careful about the second casting preps. Okay, typically, how does the exam? What do they assign to you? A lot of times, the first casting prep is an MOD onlay, either up or a lower. That was true this last exam in November. That's pretty common. Okay? They like to save the second casting prep for either a PFM or a 3/4 crown or a 7/8 crown, something on that order. So those are the kinds of things that are done most often. Usually it's going to be a partial coverage prep at the beginning, and then either another partial coverage prep or a PFM for the second. And the amalgam can be anything. Could be a molar, could be premolar. So we're going to work on all those. Okay, how are the grades assigned for each one of these parts? There are basically 6 parts that you're graded for. 3 on the first procedure, 2 on the second, and 1 on the third. So you're going to get 6 grades altogether. Okay. So how are grades figured out? Let's and then we'll relate those grades to the to your scores too. Okay. You are graded by using terms to describe how severe your error is. You're not given points because you did something well. Everybody starts with 100 points, okay? And they take them away when you do something wrong, okay? And the critically important thing to realize is that you've got 100 points and everything that you've done is perfect, except one thing which has a major error, and therefore you fail. Okay, all it takes is one major error and you fail. You don't have to have 3 or 4. Okay, you don't have to have a prep that just overall looks really bad. It can be beautiful. It can be the nicest prep they've ever seen, but have one small thing wrong with it, and then you fail. Okay, so that's life. That's not just the exam. That's the way real life works in dentistry. Okay, you do a beautiful MOD onlay prep. You forgot to put on your gingival bevels. Okay, that casting will fail. Okay, those margins will never close as much as they should, and therefore, some years down the road, that casting is going to get recurrent decay underneath those margins, and that's why it's going to fail. So everything else could be beautiful, but it failed anyway. It failed in real life. It failed in the test of use. Failed in the mouth. So that's the way we grade too. It's the critical error that you're graded on. Okay, critical errors will cost you, will cost your patient, will cost you the life of the restoration, even though everything else is beautiful. In the exam, you have one critical error that would cause the restoration to fail sooner than it should, then that preparation has to fail also. Okay, your grade, that is. Okay, so there are words that are used. You've heard me use the terms moderate and major. Okay, the words that are used to describe errors are minor. You normally don't see that word. Slight, moderate, major, critical, and last but not least, way down here in the bottom, let's see, where I'm calling it. Gross. Okay. Just the word gross sounds bad, doesn't it? I guess that's why they chose it. Anyway, where's the important line to draw on here? Well, it's right here. Above that line, you're okay. Below that line, you're in trouble. Okay. So basically, slight errors and moderate errors are the most common that you'll find for people that are passing, and major errors, that's the least severe error that will cause you to fail. Okay. And then critical errors are more severe than that. So, what is the difference between a moderate and a major error? A moderate error is something where it's not right, but it won't cause the restoration to fail before it should. Okay? It may be that you have an amalgam that has a defect at the margin, but the defect is small enough so that when the amalgam is polished, there will be that defect will go away. Okay? With a reasonable amount of polishing. I don't mean polishing 2 millimeters of tooth structure away, but a little normal polishing will remove this defect. And therefore that restoration should have the normal lifetime, the normal life expectancy. So things that are not right and that are almost to the point where they're affecting the life expectancy but really don't, those would be slight or moderate errors. Okay, if they can't find anything wrong with it, then you're up here. Okay, believe me, they can always find something wrong with it. And I will make you a promise that so far I've stuck to. I will always find something wrong with your work. Okay? I don't know if that makes you feel good or bad. It should make you feel good, because that means I'm looking at what you're doing. And the longer I spend trying to find something wrong with your work, the better you can feel. Okay? If I have to really scratch my head and look at it and say, well, this could be a little bit more like this, I'll always find something that I don't like. But overall, I might be just thrilled. Okay? And if you find that I'm having to work pretty hard to find something wrong, then you should be thrilled too. Okay? If I have a list of 10 things, if I ask you to go get a piece of paper, then, okay, we've got work to do. And at the beginning, that's the way it's going to be. It always is. Okay? But at the end, I'll have to work hard to find something wrong with your work. And that's the good part. Okay? So I will always find something wrong. They do too, so why shouldn't I, right? Okay. Anyway, down here, major, okay, you've got a problem now that will actually compromise the lifetime of the restoration. And that's something that is a failing kind of error. An open margin, defect in amalgam that can't be polished away, don't have a good contact. The occlusal reduction is inadequate, so that the clearance on your crown prep is, the gold would have to be too thin. Okay, so that after a year or two, the patient will probably just grind through the thin gold that's up there, and then there was a hole in the top of the crown. Okay, critical error is where the occlusal reduction is so minimal that the gold is so thin that it would actually be difficult to make the crown. Okay. A gross error is where the tooth is still in contact. There's no occlusal reduction in some areas, so it would be impossible to make the crown without redoing the preparation. Okay. So these are the kind of things you obviously want to watch out for. Okay. So how are these then scored in terms of numerical grades? The numbers you'll see are 5, 4, 3, 2, 1, and 0. Okay. You might think that there's the same amount of difference between each one of these, but there's not. The difference between 3 and 2 is the same as between 2 and 1, but between 1 and 0 is a vastly different thing, and I'll explain that to you in a couple minutes. Anyway, the numbers that you'll see on your grading sheets, and hopefully you won't see your grading sheets because they only show them to you if you fail the exam. But some of you have seen critique sheets before from the bench, and these are the numbers: 5, 4, 3, 2, 4. On the body of the sheet, where it asks, for specific errors about different parts of the preparation, axial walls, gingival floor, and stuff like that. They'll use these words, slightly overextended gingivally, major facial overextension, moderate occlusal under reduction, something like that. Those are the terms that they use. So then they look at the whole sheet at the end, and there's a little box down at the bottom, and if there's any major errors anywhere on that sheet, then you get a 2 at the bottom, provided you don't have critical or gross errors. So if there's one major error anywhere, then they put a 2 down there. Okay? And if there aren't any major errors, or if there's nothing down here, if the worst error is moderate, then you get a 3 down that box. Okay. So if you get a 3, you're in good shape. If you got a 2, then you're not in such good shape. Okay. How does that translate to the grade that you get, the numerical percentage that you get later on? Okay. Moderate errors, that'll give you 75%. So that's good. Major errors will give you a 65%. Critical errors give you a 55%. Slight errors give you an 85%. And minor errors give you a 95%. Okay. Now these numbers at the top are pretty nice. Okay, remember, anything below 75. If you get a 74, you're out. Okay. Okay. So if we have 2 graders, one gives you an 85, one gives you a 65, you pass. Okay, because you got a 75. One gave you 2, one gave you a 4. That's usually not the case. Usually the difference between graders is only 1 unit. But anyway, what happens down here at the bottom for gross? How many points do you get? There's no 45. You get 0. Okay. You can't recover from a 0. You can't average out a 0. Okay, it just doesn't work. You can have a critical error at some place and still pass the exam. You might even be able to pass that part of the exam. If you got a critical error on the first casting prep and then 95s on both the lab work and the wax up, okay, you can pass that part of the exam even with a critical error. Okay, that's kind of amazing. But it's pretty hard to do this. Those 95s aren't very easy to come across. Okay, anyway, this is how it's scored, and then the numerical average is calculated for both parts of the exam based on what I have on the previous sheet here. And so what you're going to be working with is moderate and major errors, trying to decide which is which. Okay, and we'll determine a very fine sense of that as the course goes on. Okay, any questions about grading or how the exam